It's bold, and it touches upon all of the areas that we've been discussing today. So legislation is important. Thank you.
Thank you.
I agree with the previous two speakers. I do think we know what works. I mean, we know what works in prevention, we know what works in treatment, and we need to use our knowledge, the evidence we have, and go out there and implement it where it's needed and scale it up. Like the President was saying, we need to take it to action, and we can't wait. We need to take those, needle exchange works, we need to take it to action, we need to take it to scale. Working with communities of MSMs and African American communities can work, and we need to take that to scale. We have interventions that we know work, but we haven't taken them to scale. We haven't implemented them. And I think there's a very important other area that we need to invest in that hasn't been mentioned before, and that's research. There are lots of unanswered questions. There are lots of ways. I mean, we've made enormous progress through research and discovery in terms of how to tackle this epidemic and how to prevent the horrific effects of the epidemic on people. But there needs to be a continued investment in research into new ways of how to prevent, effective ways of preventing transmission, and then research in better treatment for people living with HIV, research on how to do operations, how to implement these programs, how to scale them up, how to develop these networks, whether they be in New York, in Harlem, or in Lesotho. There's a lot of room for inquiry and knowledge generation that we need to continue to push on learning more, because I think through learning more, we'll be able to do more.
Thank you. Mr. President.
Well, first, I agree with what's been said. I particularly want to emphasize the importance of listening to people in discrete populations, whether it's men who have sex with men, whether it's women who have sex with the lovers who just got out of prison. I think you have to listen to whether it's kids that are in at-risk populations and turn off all the messages because they look like they come from old gray-haired people like me and it's boring. We have to figure out a way to reach people. And I particularly think that we have made a colossal oversight not doing more with the imprisoned population in general. I mean, in general, 90% of the people in jail are getting out. And now, of course, there's all this controversy over this terrible incident of the shooting of the police officers in Washington and whether that man's sentence should have ever been commuted in Arkansas and whether he could have been held in Washington. I don't know about the facts, but most people's release from prison is automatic, has nothing to do with the intervention of a clemency. 90% of the people who are there are going to get out. And we spend all this money to warehouse them, put them with people of the same sex. I think even now, only Mississippi, unbelievably, is the only state in the country that allows conjugal visits for heterosexual couples. I think they still are. And so, and by and large, that education is limited. There were scores of great college education programs in prison and an almost zero recidivism rate until 1995 when the Republican Congress, in one of their first acts after taking the majority, was to prohibit Pell Grant funds from being used to defray the cost of a college education. So now they went from scores down to about 11, 4 of which are in New York, I'm proud to say, thanks to an NGO here. But we need to go back and go back to square one on this prison population and really try to dramatically reduce either the number of people who are infected while they're in prison or their inclination out of desperation, spite, or whatever to infect others when they get out. I think that's important. Abroad, I know I sound like a broken record, but I've just seen it too many times. You train a few community health workers, you have basic, very basic refrigeration and lab facilities, you build national networks, and we'll get the medicine out there, and we'll get the money for it out there, and we'll save the lives. I will do what I promised the gentleman over there to do about the budget, but in the meanwhile, I hope you'll hold your fire. They've still got a few cards to play, and the president's in a terrible situation. I do think we will wind up doing more here, and I think it's imperative that we do. You can't be satisfied with the fact that we increased from 3 to 4 million in treatment last year when there's still more than 5 million who need it. And we just got to keep working on driving the prices down, driving the quality up, and getting the systems out there. That's what I believe. In the rest of the world. In America, it's more a set of discrete challenges. Thank you.
Let me, on your collective behalf, ask you to exert one further round of appreciation for our panel. And let me, in personal terms, thank Vox Populi for rescuing the conversation. I'm going to call on Dean Linda Freed, who I think has some final words to say. I'm sorry, the panel discussion is complete. Direct your attention to the Dean.
Well, good afternoon, and I want to end this really fabulous discussion with several comments. First, of course, HIV/AIDS is a public health problem, but I think the discussion that we just had among our wonderful panelists exemplifies that the solutions sit with all of us, and all of us appreciating what a multi-sectoral solution might be, which is appreciating the complexity of the problem and solving it together with new knowledge. I want to thank very much both the whole audience for being part of this and our distinguished panel for leading our thinking as we take stock of where we are in terms of HIV/AIDS, both globally and domestically. I particularly want to thank President Bollinger for convening this, along with Dr. El-Sadr, President Clinton for your critically important leadership in tackling HIV and other global health threats, identifying innovative solutions, and in mobilizing partnerships through your Clinton Global Initiative, and for your support and many contributions to improving lives around the world, including the Clinton HIV/AIDS Initiative, which is helping, as we all know, 2 million people living with HIV/AIDS access life-saving drugs. I want to thank Virginia Fields for your long-standing leadership in terms of HIV programs and people living with HIV in New York, as well as to the resolution of disparities broadly. We are deeply grateful. I want to thank Stephen Lewis for your incomparable commitment to justice and your relentless advocacy, which we saw a small glimpse of today and deeply appreciate, broadly and for the empowerment of women and girls around the world. And to Callie Lindsay, deep thanks for all of the work that you do on domestic issues and policy in HIV/AIDS. And I want to acknowledge Dr. Wafa El-Sadr and the Mailman School of Public Health at Columbia University, the ICAP program, the International Center for AIDS Care and Treatment Programs, which has really brought a unique approach to helping to solve the issues and problems of HIV/AIDS worldwide. Their unique approach includes working hand in hand with ministries of health, other governmental and non-governmental organizations, academia, and persons with HIV and affected communities, emphasizing the design of health systems that work, that create the ability with capacity building and technical assistance to implement a durable response to prevention and treatment of HIV and other health threats in the communities where it works, and focusing on this innovative family-centered approach as the winning way to respond to the needs of communities and strengthen the fabric of societies. And also, as with everyone on this panel, to your dedicated attention to both the U.S. and the global epidemic, marrying knowledge and science with service and training. Now, I'd like to attempt to summarize what I think we have all heard today as our charge for the future, but I also recognize that the panel is on a very tight time schedule,